Hi, everyone. So welcome to this session. Today we have Marcy Crouch. She is a board-certified women's health physical therapist and has a passion to change the way women are cared for during and after their pregnancies. She created the DT Method, a series of online programs and courses for birth prep and postpartum recovery. She developed a new standard for preparing for delivery and recovering successfully after birth. She's the proud mama bear to two boys, drives a minivan shamelessly, and loves the ocean, horses, and a good glass of wine. You can follow her on Instagram at the Down There Doc to learn more than you want to know about vaginas and to find links to podcasts, blog posts, and other publications related to pelvic floor health. So let's welcome Marcy. Welcome. It's so nice to have you.
Oh, thank you so much. I'm so excited to be here, and thank you for the invite.
No problem. So I wanted to ask you, what motivated you to become a women's health physical therapist, one who focuses on pelvic floor health?
Yeah, so it's kind of a funny story. When I started physical therapy school, I had this like completely different idea of what I was gonna do. I was like, I'm gonna be this like high level sports PT, and like I never really played sports, so I don't know why I thought that. And then in our first anatomy class, in our first year of PT school, the professor went over the pelvic floor, and she used an example of a woman who had a pretty significant trauma during delivery and all of these issues that woman had later, like pain, incontinence, all the things that I'm sure we'll talk about in just a minute. And I remember just listening to that lecture, and I had just gotten married. Kids weren't even like on my radar. None of my friends were having kids. And when she said that, I remember like my mouth just opened, my jaw just dropped, and I was like, wait, you tear during delivery? Like I couldn't even comprehend that. And the more I learned about what happens during pregnancy and after, and the more I learned about there's like this whole population of people who aren't getting any sort of like rehab or care or the things that they need before and after baby, the more I was just like, oh my gosh, I totally have to do this. So I decided kind of like right then and there that I wanted to just jump into pelvic floor health and women's health. And that's basically the only type of rehab I've ever done. You know, I've had to do kind of just traditional like orthopedics and stuff for schooling, but I really wanted to focus on women's health and pelvic floor health. So after I graduated and got my doctorate, I went into a residency for women's health. And then I've worked pretty much independently in the pelvic floor women's health space for the last 11 years. And I love it. And I love vaginas. People are like, oh, you're a PT, my shoulder hurts. And I'm like, nope. I'm like, I haven't put my hands on her shoulder in 11 years, but tell me about your pooping. And so that's kind of how it all started. And that's what I'm doing now.
That's excellent. So I want to ask you, how can women at any age benefit from pelvic floor physical therapy? And what are the key times in life that it's best to focus on one's own pelvic floor health?
Yeah, I would say any age, actually. There's a group of pelvic floor PTs that work in the pediatric space. So for kiddos who are having like constipation, bedwetting, that sort of thing. Then there's a whole bunch of studies coming out on female athlete and younger population of women who might be experiencing leaking with like high level sports. So like gymnasts, volleyball players, women who are like jumping and have a lot of dynamic load on the pelvic floor. So that space is awesome, that kind of like adolescence, young athlete. And then we kind of move into the childbearing years. So women that are getting ready for baby, pregnancy, any age during pregnancy, women are having babies, you know, up to like mid 40s. So that's totally appropriate too. After baby, super important. And then we can also help a lot of women like going through the menopausal years and into kind of like the geriatric space. We see a lot of women who have pelvic floor dysfunction, incontinence, constipation, that sort of thing later in life. So really pelvic floor health is appropriate for all ages and women through the lifespan. And if you're like a high level athlete or even just kind of like a weekend warrior and you're working on core strength, the pelvic floor is incorporated in that. So it's really appropriate for pretty much everyone at any stage.
So I wanted to ask you, how do high level athletes get impacted? Because you have this, or a lot of people might have this common misconception that, oh, if I work out a lot, if I'm, at the top of my game, like everything's going to be okay. But I'm actually surprised to hear that, okay, if my daughter, as a teenager wants to go into high level sports, or, there are athletes who are working out, like they wouldn't have any of these issues. But what
Mhm.
are what are
They
the
do.
most common things that you're seeing in this area?
So generally, we see leaking urine. So we talk about like a lot of people think that you might leak urine just like after having a baby or when you're older, but we're seeing it in a lot younger population. So if you think about the pelvic floor muscles, I happen to have my pelvis right here, so I'll show you. So all of this red stuff is pelvic floor. Okay, so these are like when we're talking about a Kegel, these are the muscles that we're talking about. And if you see, they're at the bottom of the pelvis, right? So like your tummy muscles in your core are right here in the front. This is your pubic bone. And then back here, we have the back muscles. So when we're working on core strength, we have to also incorporate the pelvic floor. And part of the job of the pelvic floor is to support us and to keep us continent. So if we have activities that are presenting a lot of load or demand on the pelvic floor muscles, then sometimes those muscles can either become weak or they can become fatigued or they lose kind of like their timing. When we're talking about function of muscles, it's not just about strength, it's about coordination as well. So when we see sports like gymnastics or volleyball or trampolining or anything that puts more kind of dynamic load on those muscles, then we can start to see some problems. So like for moms, for example, when they're like, oh, I can't jump on a trampoline or I can't run or I leak pee when I sneeze, same kind of activities can impact athletes as well. So when we're working on rehabbing the core, we have to take that into consideration also. But more with like kind of the higher impact activities, gymnastics, volleyball, that sort of thing, where there's like a lot of jumping and landing, like a lot of kind of up and down on the bladder and pelvic floor.
So is there like a happy medium of where people should focus their activity on or exercises they should do so that it doesn't, exacerbate a problem or can actually heal that issue?
Yeah, I mean, that's where pelvic floor PTs come in for sure. I mean, if there's any sign or symptom of like leaking urine during a game or running, then that needs to be addressed immediately because that's telling us something in the system isn't working. So I would say like specific exercises and techniques should be prescribed by a PT who's trained in pelvic floor function and can usually weave pelvic floor rehab into whatever other exercises and training the athlete is doing. Oftentimes we see in like really kind of strong, high tone people who like do a lot of core work and a lot of exercise that it might not be that the muscles are weak, but in fact they're too short and they're not able to contract and relax the appropriate way. So maybe exercises and strengthening aren't appropriate for that person and they need to focus on like lengthening and relaxing and training the muscles more from like a coordination control standpoint. Usually when we see that, we oftentimes might have some like pain symptoms that surround that, like pain with sex, pain with tampons, and pain with like vaginal penetration, because those muscles are just too tight. They can get overworked, just like any other muscle. Like if you have shin splints or a strain in your neck or a hamstring strain, pelvic floor can do the same thing. So if we're overdoing it and overdoing it and overdoing it, then we start to kind of see either leaking or pain or, kind of other symptoms like that. So specific exercises are like very kind of patient dependent, but a trained PT can decide, what course of action needs to take place, but it shouldn't be something that should be ignored. Like pain with vaginal penetration is not normal. Leaking urine is not normal. Those are all kind of signs that are telling us that something in the system is not working optimally.
Absolutely. And I'm glad you brought that up because I've heard from a lot of moms that, oh, well, I just had a kid or I had this many kids and, I leak when I laugh or I run. And that's not
Mm-hmm.
normal. You've got to see somebody for that, a professional
Girl,
to help you.
yes. And I feel like I say this all the time in my social media and I say this all the time to my patients that common and normal are not the same thing. Like just because it's common that people leak urine after baby or have stress incontinence, which is like leaking with laugh, cough, sneeze, jumping, that sort of thing, doesn't mean that the system is working optimally, right? Like that didn't happen before baby. Like, so like what's happening, why is it okay now? So totally. I feel like if everyone either kind of got a little bit of assessment and treatment during pregnancy and before to like prepare for delivery, to know what to do kind of firsthand, and then had a really comprehensive plan after baby, like that 1 6-week appointment is not enough. And oftentimes we get like, okay, go back and do whatever you were doing before baby. Like you were running, before you got pregnant, so go for it. And it's like, well, I haven't been running for 9 months, and like this human just came out of me, and maybe I had a C-section and I had like a major abdominal surgery. I can't just like start running like I was before baby. So this kind of like normal, return to activity is not appropriate. And we don't do that for other athletes or other people who have had surgeries or even sprained ankles. Like that's not what we do. We like rehab and we train and we have a plan. And so this whole like kind of normal to have pain, normal to have leaking is not true. And we don't say that for any other part of our body. So that's pretty much why like I have a job and why I love what I do, because it's not okay. And like moms can't, it's like, why are we saying that this is what life is going to be like now? We don't do that for anybody else. Like, I don't want to pee every time I sneeze. So like, how do we change that?
For sure. Discussing that 6-week mark, it seems totally unrealistic that every woman would be okay after the 6-week mark. And after talking to a lot of women, especially women who've given birth, it seems like there's a wide range of time periods that it takes women to heal. What have you personally seen in your own practice?
So anecdotally in my practice, I've seen lots of different things. So that 6-week mark, that kind of 6 to 8 week time frame really is for tissue healing, because we know that like wounds are closed and healed around that mark, right? Like that's what happens from a physiologic standpoint. But that doesn't mean that you are recovered or you are like healed from like a comprehensive standpoint. Scars heal, wounds heal at 6 weeks, but think about what your body just did for 9 months. And other athletes or other people who have like either injuries or have been training for something for 9 months, like that 6-week mark is not enough time. And like usually the first 3 weeks, like we're just still bleeding and we're like recovering and we're figuring out like feeding and we're not sleeping and we have all these hormone changes. And so I really feel like it needs to be like just a lot more time. And there are women who feel amazing after, and like that's great. I think there's a genetic component to this too, just how your body responds to trauma, and how your body responds, and just like what your cells are doing. But I think a lot of women need a lot more time. And there's been some new studies coming out. There was an expert opinion that came out a couple years ago, maybe 2 years ago now, about returning to running after baby. And they're saying like it should be a minimum of 12 weeks, and you need to have like XYZ done beforehand. You need to be able to do these things without symptoms before we start a running program. And like 12 weeks is, that's 3 months of like a return to jog program where you're doing like walk, jog transitions, and you need to have all these things in place beforehand. So if you just kind of think about what your body has done and the load that it's had for 9 months, like no other muscle in our body has to do that. And then our pelvic floor has to open, and then it has to close again. And that is the floor of our core. It's like, it's what is holding us together and keeping us continent. Like our bicep never has to do that. So it just needs, like, I just feel like there needs to be a lot more comprehensive recovery and a lot more time. And the societal norms of being like, oh, we have to get our body back. Like we have to start running and get into those pre-pregnancy genes at 6 weeks is like ridiculous. And sometimes it takes a year. Sometimes it takes longer than a year. Sometimes it takes 5 months. Like it's a little bit different for everyone.
I've heard that too. And that's really eye-opening and really helpful to consider, because, then people know they're not alone, and this, each person is different. And that's really, really helpful.
Yeah.
What about certain countries or cultures where I've actually overheard women say, you know, they won't have a vaginal birth because it will destroy their pelvic floor. And they think that having a C-section is the solution. Some women think that, you know, they'll never go back to normal or, you know, have pain-free sex, or they will become incontinent if they give birth vaginally. What would you say to that?
Well, it's tricky. It's definitely tricky. And I am one of these providers who, you know, I don't judge. Like, I support the mama in kind of whatever decision they want to make regarding their delivery and their birth. However, I do feel like I need to educate them on kind of like what to expect each way. So, you know, I feel that we are lucky that we live in a society and world where C-sections are available. You know, they definitely save a lot of lives. But C-sections are a major abdominal surgery, and they are not protective of pelvic floor dysfunction. So I do see a lot of moms who have C-sections who still have some of the same symptoms as somebody who has a vaginal birth. The rates are a little bit lower, like maybe, you know, leaking and prolapse might be a little bit lower in C-section mamas because there's not like that pushing phase. However, they still have a baby on their pelvic floor for 9 months, and they've had a major abdominal surgery that requires a little bit more intensive rehab afterwards because we're dealing with the scar, we're dealing with abdominal muscles that have become stretched and moved out of the way. I see plenty of C-section mamas who have a lot of residual pain afterwards, either scar around the scar or like pain with sex and that sort of thing, because the pelvic floor muscles are too short. Now, all things that can be dealt with appropriately with therapy and programs and that sort of thing. But I do think that there's kind of, I don't like to say pros and cons, but there are things that come with both for some women. You know, some women have no problems after, and some women do. So I think it depends. But my job is to educate and share facts and data and what the literature is showing and what I've seen clinically, and come up with a plan. So the mamas feel that they, you know, have something in place afterwards. But you know, whatever they want to do, I support, as long as it's safe and everybody's taken care of and they know what the literature is saying, and that everybody's in agreement, doctors, PTs, mama, that sort of thing.
For sure. So basically, even women who've also given birth vaginally, whether it's vaginally or by C-section, would benefit from seeing a PT.
Oh, 100%. I mean, my goal before I die is that this becomes standard. So like, I want everybody to see pelvic floor PT or have access to programs like mine at the 6-week mark. Like, it should be the same. Like, when you are going into your 6-week postpartum appointment, you either also get to see a pelvic floor PT, or you get, like, you know, an online program like I have. I also want pelvic floor PTs to be on the postpartum floor, because there's a lot of things that we can help with, like super easy little things. And I actually go over these in my program too. That's just like how to get out of bed, what position you should be in with nursing, how to poop the first time, how to start to like roll over when you have a waterbed for an abdomen, like all these little things that you don't think about or think that you need help with until after. Right? Like, I remember after my first baby, I was just like, and I'm a PT, I was like lying on the couch and being like, I cannot get up. Like, I don't even know how to activate this the right way. I was just like, oh my gosh, what is happening? So I think having those resources and a little bit of help from day one will stop a lot of problems later, and just give the mom more resources and support so they can like enjoy their baby and be like, okay, I know how to get up, I know how to poop, I know like how to make pain less in my vagina, you know, that sort of thing. And I also want everyone to start PT prior to baby, because we can do a lot of things before delivery to just kind of set us up for success. There's not a ton of studies that show like, you know, like the way that I think about it is like, when you go in for knee surgery, like if you're having an ACL reconstruction, people do better when they've had physical therapy prior to surgery. And so it's the same for me and pregnant mamas. Like, if we can do some like birth prep stuff, body mechanics training, functional strengthening, have a plan in place, recovery stuff from day one, then later I think they'll be better off, because they know who to turn to and like who their support group is. And two, they've already started working on these structures. So they're like, okay, Marcy taught me how to get like my pelvic floor engaged, my abs, and how to breathe the right way. So when I'm rolling over, I have this like huge scar in my belly. I know how to do that. And then she's given me, you know, XYZ to start at this time. So then it's not like 6 months postpartum and they're like, oh my God, I've been peeing and I've had all this pain and like, I don't know what to do. It's like, okay, I've done this already. And it's just so much more comprehensive. And it's so much more than just like exercises. It's like giving women support and validating their concerns and not just being like, oh, you had a baby. Like, that's it. You just had a baby. What do you expect? It's like, we see that you need this type of help and your body is important and it's not more important, you know, than like that person who had like a knee surgery. Like that knee surgery is not more important than you. And that's the message that we get all the time, is that like, we just had this baby and like now the baby has a million appointments and we get one and we're just supposed to like wear a pad and figure it out. But then this person who just had like knee surgery gets like physical therapy before, physical therapy in the hospital, physical therapy after, like a team of providers, 700 appointments, like, and like mamas don't get anything. And that's just saying like, we don't value you, but we value this sprained ankle. And that's not what I'm about. So if everybody had this sort of care and these programs, then I think it would change so much, not just like physical, but like just elevating the status of women and just showing that they're valuable and that we care about them.
Absolutely. What you said right now is just really powerful, because I think, you know, there are countries that value physical therapy and pelvic floor health, but even
Totally.
maternity care, you know, especially in the US, there are so many changes that need to happen. It's not okay where it's at, but it could be better. We have all these great professionals there, but it could be better. And
Totally.
yeah, I read an article that was talking about how in France, actually insurance covers pelvic floor therapy. It's actually required, kind of like you go to a doctor or midwife, you know, to have a care provider for your birth, you also are assigned a pelvic floor physiotherapist. So you see that happening anytime soon in North America?
Oh my God. If that happened, I would like, I'd be like, yay. Yeah. So I actually wrote an article about that for Healthline, and it is, so in France it's called perineal rehab, and it is standard of care, and they come to the house and do it for mamas. Like, yep.
Wow.
And shockingly, women in France see less leaking, less pain, less surgeries down the road because they've already started dealing with it from day one. So that would be like my ultimate if the US, you know, would do something like that, or in North America. But I think that we're a long ways off from that, unfortunately, which is why I created these programs and why I was like taking what I was doing in the clinic virtually, because I want it to be more accessible for more people. And it's almost like grassroots, like we got to go directly to the mamas. Shouldn't be like that. It should be provided. But I think now in like the technological age of, you know, social media and all these things, like people are finding that there's more answers for them and more resources. And so they're kind of coming directly to people like me. But yeah, man, I mean, and I've had patients who have had babies overseas and then they come here and have babies and they're like, what the hell? And I was like, I know. But I mean, I would say like in my last 11 years of practice, like I didn't get a ton of physician referrals. It was all like women finding me on their own. I mean, I had some, but the bulk of my practice was mamas coming to me and being like, I don't want to have pain with sex. I want to run and not leak. I want to be able to like run after my kid and jump on a trampoline. And unfortunately, the message that they got from their providers were like, oh, well, it's just what it is now, or you're going to have another baby, or physical therapy doesn't work, and just do Kegels. And they're just like, I don't accept that answer, when maybe 20 years ago it was like, okay. But now it's like, they can find more answers online a little bit easier.
Totally. That's why it's so helpful to become informed. And it's really great that you're providing this information. So I wanted to ask you, what are your top tips for pelvic floor health and for birth prep and postpartum recovery?
Top tip. So I would say pelvic floor health in general should just be like considered part of the deal. So when you are working core and when you are doing exercise, we need to be thinking about your pelvic floor. So the first thing that I usually do when I teach pelvic floor exercises for my patients is functional. So like, I don't like just sitting at a stoplight and squeezing your vagina. Why would we do that? We don't leak urine when we're sitting at a stoplight squeezing our vagina. So we need to train the pelvic floor in functional situations. And oftentimes like just doing Kegels is not going to do it because it's so much more complex than just squeezing vaginal muscles. So best tips I would say would be like functional, like figure out where you're having problems. Do you have problems when you're just getting up from the chair? Do you have problems when you're sneezing? Are you okay until mile 3 and then do you start leaking? Do you have heaviness in your vagina when you're picking your kids up? Like figure out where the symptoms are impacting your life and what they're preventing you from doing. And that gives us like a good starting point. So that's kind of like my biggest tip is like functional and how it's affecting you and when it's affecting you. And then we can kind of design a program and figure out what we need to do. For birth prep, my biggest tips are to, so I have a birth prep course, it's called Prep and Prevent. And we talk about all the things that you don't get in traditional, like childbirth classes. So those classes are helpful for sure, but we also need to bring in pelvic floor for that. So how to push the right way, how to do perineal massage, how to breathe the right way, what questions to ask your providers. So you need to be thinking about pelvic floor during pregnancy and right up to delivery. And if you're experiencing any symptoms like leaking urine, heaviness, prolapse, back pain, pubic bone pain, all of those are signs that we need to start maybe addressing that now. And even if you are 38 weeks pregnant, there are still things that we can do to either make you more comfortable or to just start getting your pelvic floor working the way that it should. Big tip for delivery is that Kegels don't push a baby out. A lot of times women think that having a strong pelvic floor is what's going to push your baby out, but the pelvic floor muscles, their job during delivery is to get out of the way. So they need to be able to lengthen and they need to be able to bulge appropriately. Kegels are strengthening contraction exercises, and for delivery, we have to do the opposite. So we need to learn how to do that. And I talk about that in my program, and pelvic floor PTs can teach somebody how to do that. So I would just say like biggest tips would be to make sure that you can figure out the difference, like muscles have to contract and relax, and then figure out where you are functionally and where and how it's impacting your life.
Very cool. That's actually very, very helpful. I find a lot of programs and perhaps like instructors in different fields who might not be pelvic floor physiotherapists, like when they're trying to tell or teach mamas to do Kegels before giving birth, sometimes it can have the opposite effect because they're instead of relaxing, they're contracting and it impacts birth. I mean, as a doula, I've seen, it's like you have to try to get that mama calm so she can just release and move with everything. Yeah. Sure. That was so helpful. So I wanted to ask you a little bit more about your programs. Which programs do you have, and can you give us a little bit more details on what they cover?
Sure. So I have 2 right now. I have the first one that I launched in the fall of 2020 is called Foundations. So it's my postpartum course. So it's Foundations, Build a Better Core is the name of it. And I do have pregnant mamas that are in there. I just have some modifications for them, but it's designed really for like that 6-week mark on. And it is not a like post-baby boot camp, but like it's basically like everything that I did in the clinic rolled into a 5-week program. So this is like, I really want mamas to understand that like in order for them to recover comprehensively and do the things that they want to do, whether it's like running a marathon, CrossFit, walking down the street with their baby in a stroller, the foundation needs to be in place. So I teach like very basic foundational pelvic floor and core rehab exercises, movements, functional everyday activities, just to start to get your core and your pelvic floor working the way that they should, because pregnancy and birth turns it off. So what happens is that when those are kind of turned off from like a control and strength standpoint, and then all of a sudden we have to like carry this baby that's only getting bigger, and then at 6 weeks we want to start exercising again, we don't have those like that groundwork isn't there. So we start to see symptoms and problems. So foundations is really based on building that up. And I spend an entire week 3 is just on return to sex. So it's all about like why sex could be painful, what to do about it, how to work on scars, how to use lube. It's like an entire week dedicated on pelvic floor lengthening, relaxation, and returning to intimacy. And then the other weeks kind of build on every other week. And it's designed for mamas to be able to come back to it as needed. If they want to progress up their training, if they decide they want to run a 10K or something, you can come back to foundations, make sure everything is doing what it should be doing, and then you can kind of progress up. So they have access to it for life. They get access to it, to all of the updates and revisions. In fact, I just reshot it, so the new videos will be coming out at the end of February. They're shorter, they're a little bit more compact. I took feedback from my mamas that were in it and just made it a little bit more efficient. I'm super excited about it. It's going to be awesome. And then, so you can always go back to it. You can always rewatch it. The mamas get a private Facebook group, and then you also get access to me to do like live Q&As. So as you go through the program, if you have questions about specific symptoms or exercises, then I'm available for that. So I'm super excited to have it out there, and the feedback I've gotten has been really great. And it's just something that everybody needs, and it's easy to do, and you can do it like while you're washing your pump parts or while your kids are in the bath. And it's like, what I found in the last 11 years of practice is that moms don't have time to like get on the floor and do like 30 minutes of boring PT exercises. Like, I won't do that. There's no way that I'm going to do that. So I designed this to do what I do in the clinic and weave it into everyday activities. Because if you think about like how many times you get up from the ground, I mean, that's like 50 reps right there. And so like you've already done 50 reps and like you're good for the day. Or every time you like lift a baby out of the crib or into it, like those dang car seats that are so heavy, like that's all opportunities to do foundational work. And so that's kind of how I designed the program. So that's foundations. I love it. And then the second one that I have out right now is a prep and prevent. So this is my birth prep course, and it's for mamas who are at any stage of pregnancy. And it's 5 sessions. And then I have a bonus video, that I'm working on right now, but I believe I'm going to have a hypnobirthing person come in and do like a little bit of breathing meditation training for the bonus video. And then we have 5 weeks of preparation for delivery and then early recovery. So what you need to be doing from day 1 in the hospital and like kind of that first couple weeks at home. And then you can start into foundations at the 6-week mark. So this is basically everything that they don't teach you in traditional pelvic floor or traditional childbirth exercises. I teach pushing, labor positions, partner support, perineal massage, basically everything that just kind of focuses on like getting your pelvis ready for delivery, and then early recovery from day 1. So like pooping, like that first poop, and like I talked about earlier, like how to roll over in bed and what garments you should be wearing and how to like relieve swelling in your vagina and how to take care of the scar and all those things that like you don't get but don't know you need until it happens.
Excellent. Thanks for sharing those. We'll include the links below too. And
Yes,
yeah, thank you so much for, attending the summit, speaking to me about this and speaking to us all about this. It was really, really informative.
Good. I'm so glad. I'm happy to do it. I'll talk shop any day.
Excellent.